Hello, and welcome to the American Lung Association's Indoor Air Quality and Energy Efficiency in Schools training series. In this video, we'll discuss how indoor air quality and energy efficiency can impact health and learning in your school. Let's get started. Indoor air quality, or IAQ, refers to the air quality within and around buildings and structures, especially as it relates to the health and comfort of building occupants. Most people understand that outdoor air pollution negatively impacts health. The same holds true for indoor air. If air quality is poor, health is impacted. Before we get into the components that influence indoor air, there are a few key facts to keep in mind during this training. We take an average of 22,000 breaths each day. 90% of our time is spent indoors, and indoor air pollutants are often 2 to 5 times higher than outdoor levels. These facts will be important as you learn more during this training. Indoor air quality is complex. There are many variables that influence whether the air you breathe indoors is good or bad. You can think of it like a puzzle with all the variables being the pieces. All the pieces connect and create the full picture of indoor air quality. For this training, we won't go into detail on each of these variables, but we will focus on understanding indoor air pollutants and how to address them, because that is often the easiest way to start improving our indoor air quality. Indoor air pollutants can be categorized into 4 types: gas pollutants, biological pollutants, particulate matter, and volatile organic compounds. You can see what kinds of pollutants make up each of these categories. We'll talk more about their impact soon. Knowing that many pieces influence the air quality, let's look at the impact our indoor air can have on our respiratory system and overall health. We'll start with a quick review of how our lungs work. When you breathe in through your nose or mouth, air travels down your airway or trachea, dividing into your right or left lung via the bronchi. The bronchi then separate into small tubes called bronchioles. Like tree branches, bronchioles divide into thousands of even smaller passages. At the end of each bronchiole is a cluster of little air sacs called alveoli. Alveoli are wrapped in tiny blood vessels called capillaries. The air you breathe in fills these air sacs with oxygen-rich air. Here's where oxygen is transported throughout the body. When air pollutants are breathed into your lungs, they can impact any of these parts of the lung and even pass into your blood in some circumstances. The health effects of poor air quality can be felt immediately upon exposure, shortly after, years later, and at any point in between. We don't yet know how long or how much is needed to produce a specific health problem. Some short-term effects that may result from poor air quality include headaches, dizziness and fatigue, irritation of the eyes, nose, and throat, shortness of breath, and chest tightness. Some long-term effects that can result as far as years after exposure include respiratory disease like asthma or COPD, heart disease, and cancer. This list depicts sources of air quality and their known health effects. Some of these include asbestos, which can cause lung cancer, mold, which can impact asthma symptoms, upper respiratory tract symptoms, and breathing problems, carbon monoxide, which can lead to death, central nervous system damage, and be a general lung irritant, and cockroaches, whose dander can lead to asthma symptoms, allergies, stomach issues, and communicable diseases. And the list goes on to include pollutants such as particulate matter, radon, rodents, and VOCs. You can see just how many air pollutants exist that can have damaging effects on our bodies. Air pollution, whether indoor or outdoor, impacts individuals at all stages of life, from preconception to older adults. But certain populations are particularly vulnerable. Children, older adults, and people with pre-existing health conditions spend more time indoors, increasing their risk of exposure to pollutants. Older adults are less able to fight the effects of pollutants and are more likely to have multiple health conditions. Children take more breaths than adults and are also closer to the ground, where pollutant concentrations are higher, putting them at higher risk. Individuals who are pregnant and their babies are also at higher risk for adverse health outcomes as a result of poor air quality. People with pre-existing conditions like asthma or COPD are especially vulnerable because air pollution can make their conditions worse. Research is also very clear that communities of color and low-income communities are disproportionately impacted by air pollution. These communities are more likely to live in substandard housing, live in closer proximity to high pollutant sources like factories, highways, and ports, and have higher risk of chronic disease, which can be exacerbated by pollution. As a result, they are more likely to experience missed days of school and work and experience financial strain as it relates to pollution-related hospitalizations and emergency room visits, ultimately furthering health disparities. Now that we know the health impacts of poor indoor air quality, let's look at why schools are an important place to start making improvements to see immediate benefits. Earlier, I mentioned that we take an average of 22,000 breaths each day. On average, adults take 12 to 20 breaths per minute, equating to about 17,000 to 28,000 breaths per day. If you've been around a child, though, you'll probably notice their respiratory rate is faster, taking about 2 to 3 times more breaths than an adult. It can vary with age, but on average, children take 16 to 24 breaths per minute, equating to about 23,000 to 35,000 breaths per day. This simply means children can breathe more pollutants into their lungs than adults. Additionally, small children are lower to the ground, where pollutants are more likely to be found, and their hand-to-mouth behavior can increase their exposure. Children's bodies, airways, and other organs are still developing and can be more sensitive due to their smaller size. The school buildings also create challenges for indoor air quality. These boxes indicate that there are roughly 100,000 school buildings in use in the US. The average age of the main building for a school campus is 49 years old, and children outnumber adults in schools about 8 to 1. Schools have around 4 times more occupants than typical office buildings. Higher density can make ventilation and filtration harder to control. To compound that, schools often have multiple sources of pollutants that may not be found in other buildings, such as kitchens, art chemicals, numerous cleaning supplies, building supplies and materials, and vocational education materials that can all share one ventilation system. As we know, schools often face major budget constraints and competing priorities as well. You can see a few examples here of how this impacts facility management. Improving IAQ often impacts energy efficiency and vice versa, which is why it is important for schools to work on IAQ and energy in tandem. After staff salaries, energy is generally the largest cost in a school's budget. We look at electricity consumption, HVAC can account for 35 to 45% of total electricity use. Adopting policies and practices that address both IAQ and energy means schools can improve building performance while lowering costs. Properly maintaining and optimizing the HVAC system is one example of how schools can improve both IAQ and energy efficiency. We won't dive too deep into energy use today, but it's important to note that IAQ and energy management should be assessed and addressed together because of their direct tie. The American Lung Association offers additional resources and trainings on energy efficiency and indoor air quality. When it comes to schools, poor indoor air quality has consistently been linked to several adverse outcomes, such as decreased work productivity by the staff, decreased academic performance and test scores by the students, increased absenteeism among students, and increased missed workdays among staff, which can then result in higher costs and decreased performance, increased spread of airborne bacteria and viruses, impaired focus, comfort, concentration, and decision-making abilities, as well as dizziness, tiredness, difficulty breathing, headaches, and coughing among the staff and students, and health effects previously mentioned, including severe allergic or asthma reactions and long-term impacts like lung or heart disease. Let's revisit some important numbers. As a reminder, it is estimated that pollutants are up to 5 times higher indoors than outdoors. This is important as children and adults spend up to 90% of their time indoors. In 2022, there were a total of 54.3 million students enrolled in K through 12 schools and approximately 6 million adults working in schools. Additionally, 50% of these K through 12 students attend a school that doesn't have an IAQ management plan. We know that students who attend schools in low-income, disadvantaged, and tribal communities are more likely to be exposed to poor indoor air. When you take everything we just covered into consideration, such as children are more vulnerable to poor indoor air quality, IAQ can impact the health and attendance of students and staff, as well as students' academic performance. School buildings are complex and pose a unique challenge in IAQ management, energy efficiency, and that schools house large population of adults for long periods of time. It's clear to see that there is a major need for energy efficiency and indoor air quality management in schools. Now that you know the importance of indoor air quality in schools, let's look at some ways to make improvements. We typically categorize IAQ improvements into 3 methods seen here. Source control to eliminate or reduce the source of the pollutants. Ventilation, when the source control is not possible, it's important to increase ventilation to dilute the pollutants inside. And finally, air cleaning, using a mechanical filter. These 3 categories will guide the solutions we're about to discuss. Making improvements to indoor air quality doesn't have to be expensive. Here are some low-cost solutions that can be implemented in schools. Use non-toxic cleaning supplies to reduce exposure to harmful VOCs and other irritants. Remove pets from the classroom, especially those with fur and feathers. Implement fragrance-free policies. Remove plush furniture and stuffed animals from classrooms. Allow fans to supply outdoor air continuously during occupied times. Keep areas near vents clear to allow air to flow freely. Implement anti-idling policies. Ensure classrooms are thoroughly dusted and vacuumed using a HEPA filter vacuum. The American Lung Association also offers further guidance on proper dusting and vacuuming methods if you need them. Keep outdoor intakes clear of debris and obstructions, reduce clutter, and minimize food in the classroom. There are also major improvements that schools can make when the budget and staffing allow. These solutions can make large impacts. These include increase the efficiency of HVAC filters to the highest rating possible, change or clean HVAC filters at least every 90 days, assess, maintain, repair, and update the HVAC systems, test for radon every 5 years and mitigate if elevated levels are found, install walk-off mats at all building entrances, and fix any water leaks or sources of water intrusion. Here are a few more major improvements that can be made in your school. Turn off lights when rooms are not occupied. You can also consider installing motion sensors to make this a little bit easier. Install Energy Star qualified LED bulbs and LED or smart projectors. Activate power save settings on computers, printers, and copiers. Replace kitchen and cafeteria equipment with energy efficient models. Install automatic shut-off sinks and low-flow faucets and toilets. And keep entryway doors closed and don't heat or cool unused rooms. Your school may already be using some of the practices mentioned in these slides. If not, no need to worry. The American Lung Association is ready and excited to assist schools in every step, from building assessment, developing an energy efficient indoor air quality management plan, and even implementation. The American Lung Association launched the Clean Air School Challenge, available to all K-12 schools nationwide, and we invite your school to join. The Clean Air School Challenge, or CASC, is an engagement and recognition program empowering K-12 schools nationwide to assess their indoor air quality and develop energy-efficient IAQ management plans. Clean Air School Challenge meets schools where they are in their energy-efficient IAQ management journeys. Participating schools receive support and guidance as they work their way through the 3 program phases: assess, plan, and act. Benefits of participation include recognition, training, and technical assistance, a structured path and support for development and adoption of an EEIAQ management plan, peer mentorship, resources and programs to engage school staff, parents, and the community, and the option to apply for mini grants to support actions at each step. Participating schools will receive several benefits for signing up to CASC. As just mentioned, this is a training, recognition, and technical assistance program. Thus, much of what participating schools will receive is education and exclusive training about school-specific IAQ challenges and topics with the aim of building their capacity to address IAQ issues and take steps towards developing a management plan. The Lung Association will offer technical assistance and provide participating schools with recognition for their efforts as a leader in working toward improving IAQ in their schools. Schools will also have an opportunity to work with peer mentors. And finally, they will have opportunities to participate in learning collaborative cohorts and be able to apply for mini grants. Let's talk momentarily about the mini grants. Mini grants are a special benefit to participating CASC schools through a non-competitive application process. Application criteria and the form can be found on lung.org/CASC. Schools must be a CASC participant to apply. Grants are open to all K-12 schools, public or charter, and schools in tribal communities. Priority of funding will be given to Title I tribal and rural schools. There will be 3 types of funding based on where that school is in their journey of addressing IAQ. These types of funding align with the phases: assess, plan, and act. Assess grants allow schools to conduct IAQ and energy assessments of their building. The plan level funding will assist with management plan development. And funding at the ACT level allows school to expand and enhance their existing plan and implement key pieces. Up to 10 schools per district can apply. Schools can apply for the next level after they complete the prior one. So how can you get involved? If you're a school nurse, consider taking the initiative to sign up your school for CASC, or talk with your administration team and encourage them to sign up the school. But be sure to stay involved with the team as they start taking action to assess, plan, and act. You can also educate school leaders in your community on what you've learned about IAQ and energy use. If you're a school leader, visit us at lung.org/CASC to learn more about participating, or sign up your school to participate in CASC. And then finally, share CASC opportunities with other school leaders. Our team is always happy to answer any questions at the email found here, casc@lung.org. This training was developed as part of the Clean Air School Challenge. Visit lung.org/CASC for more information, or reach out to us at casc@lung.org. Thank you.